come through you, but not from you.
Okay, so would you always recommend a vaginal or a normal delivery if
Vaccinations have been the single most important discovery of mankind?
So what are the tips that you would give to mothers out there who are struggling with breastfeeding?
We learn a lot about family dynamics by interacting with parents, and then there's so much negative input given to the mother
Are we administering too many immunizations? So Dr. Gayathri, welcome to the channel. We're excited, super excited to have you here. You're a pediatrician by profession, and there are a gazillion topics that we want to cover. But let's start from the beginning. Let's start from where you went to medical school, and why did you choose pediatrics as a specialty?
Yes. So I went to Bangalore Medical College, both for my undergraduation as well as my MD in pediatrics was from Bangalore Medical College. Pediatrics was always fascinating to me, and I had decided early on that I will do pediatrics as the life of children was something which always attracted to me. They are so innocent, they don't lie, and none of these habits of alcoholism and other lifestyle things which we see in adults who actually lie to their teeth despite having all those habits. I said I will not have to deal with the bunch of, all these lifestyle issues if I take up pediatrics. And it was just that innocence and, that liveliness they bring into our own lives. That is what made me, take up pediatrics as my specialization.
Okay. So were the hours in medical school as crazy as they are now?
Absolutely. 36-hour duties to sometimes even 48-hour duties are the norm. And sometimes it's like every alternate day or once in every 3 days. So, but looking at that time, it used to be a little, taxing. But then looking back, those were the best years. We learned a lot in the wards while handling patients. And actually, I really missed those days where, we actually were in charge, the front line, to deal with all these different cases which walked in. Especially since I trained in a government hospital, we had a range of cases presenting to us, and we were a tertiary referral center. So all those hours in the ward were absolutely, all the learning happened there in the wards. I learned a lot by interacting with these patients. So I don't have any complaints or regrets about those long hours.
Okay, tell us a few things about your first few jobs. Was it always a clinic or did you ever practice in a hospital?
So after I finished my post-graduation, I did work for a WHO project on HIV. This was to prevent mother-to-child transmission. I worked in that project for about 3 years, and only after that I decided to start a clinic of my own. And mainly because I wanted to provide ethical, compassionate care. And what I really felt was communication was a big drawback among many doctors, mainly because they don't have the time or they don't want to take that effort to sit and tell it in a language which the patient understands. So from the beginning, I thought that is one deficiency which I should address. And the freedom and the flexibility which a clinic allows, I was, not under any pressure from anybody. And that is why I decided to open a clinic of my own.
Okay, so you frame it very positively. You have the right to do what you want, no pressure. But honestly, setting up a clinic sounds like a nightmare. The rent to be paid, all the legal hassles. How did you go about it?
Right. So even now, I have actually moved away from my own clinic setting to a hospital setting. I now work for Shishuka Hospital in Malleshwaram. So I have moved away mainly because there is a lot of paperwork involved, a lot of licenses which have to be renewed at regular intervals, and the staffing problem. You need empathetic staff around you to help you with the clinic setting, and that has been a challenge to find. So after almost 20 years of having my own practice, this paperwork and getting these licenses in order, that really was not my cup of tea at all. And so I decided to join a hospital setting, which again offers me the same kind of freedom, flexibility, and they take care of all the administrative work now. So I feel relieved because I'm more dealing only with whatever I really want to do, which is treating patients and not dealing with the admin part of running a clinic.
How long did you run your own clinic?
For almost 20 years, I ran my own clinic.
Okay,
And
so
yeah, for the last year and a half, I'm with the hospital setting now.
so 20 years of landlord challenges, all the admin work, everything else to deal with, and now you're in a somewhat better place, you think?
Yes, there has been a trade-off, no doubt. But I think the trade-off has been a good trade-off because I was careful in not getting into a setup which would make me lose my flexibility or my ethics. And by the grace of God, I've had a good, the hospital setting I have joined, they do share my vision, and they are also providing the same ethical, compassionate care to middle class background or upper middle class, sometimes even lower middle class. We are able to handle really well. And we are trying our best to provide ethical, compassionate care. And in that sense, it's just been a continuum from my own place. And I'm grateful to the management for that.
Okay, awesome. Okay, so let's come to the clinical world or the world of regular human beings. A child is born, let's say the child is a day old, 2 days old, and now they're coming to your clinic regularly. What are the few things that you look at in a newborn, in a neonate?
Right. So we first look at, whether this baby is a term baby or is it a preterm baby. How was the initial, was this baby born from a caesarean section? Was it a normal delivery? Did this baby cry immediately at birth? If I'm looking at a baby less than a week old, there are many concerns. First of all, feeding issues, whether breastfeeding has been well established. So many mothers, especially first-time parents, they need a lot of support with breastfeeding. And it's very important to insist that they start latching and breastfeeding very early. In fact, within half an hour of birth is what the recommendation is, that we try to follow it very strictly. After that, we also look at bilirubin issues. Such many children do have jaundice when they are born. So that is an important point to look at. Then if they are preterm, there are many other issues like hypothermia. They lose their temperature easily. Sometimes they go into hypoglycemia where the blood glucose levels can really drop quickly. And that is an important point to look at. So preterms have their own challenges, and it's very important to monitor those babies very carefully. Some babies are born to diabetic mothers. They need extra attention. So it actually depends on what the background is. For each baby, it will not be the same. So we look at the history and then address each and every issue, especially after they are in the first few days.
Okay, so I bet there are a gazillion things, but the one thing sort of common to almost every parent or mother out there is this normal delivery versus C-section. How much does it count after the baby is delivered? Let's just say it's a full-term baby. How much does it count?
It does make a big difference because mothers who have delivered by the normal route, they are up and mobile very quickly. Within 24 hours, they are up, they are able to breastfeed well. But for cesarean section mothers, there is an excuse for them not to move about much. And therefore, breastfeeding, they are usually reluctant to breastfeed the babies earlier. Though now, even for cesarean section mothers, we insist that they breastfeed within half an hour of birth, and we mobilize them within 24 hours. They are also up and walking, but because of the pain issues, they tend not to put in that kind of effort what is needed for breastfeeding as babies who are born through normal delivery. Though things are changing, most hospitals now are breastfeeding baby friendly hospitals, which means whether the baby is born through a normal route or by a cesarean route, breastfeeding is insisted very early and within half an hour of birth.
Okay, so would you always recommend a vaginal or a normal delivery if it allows, if it permits?
Absolutely. I think nature has designed in a way that I think almost 90% of the deliveries have to be by a normal delivery. There are instances of, 10, 15% where nature, is in a way that, it's a breech delivery or there are complications, other kind of complications, and then cesarean becomes a must. For that, definitely cesarean is a route, but to a large extent, it should be a normal vaginal delivery.
Okay. So let's say now child is born, child has come to your clinic and you're evaluating them. I know that you're big on breastfeeding and encouraging mothers to lactate for the first 6 months, exclusive breast milk. So people have even told me that you actually play the role of a lactation consultant and not just a pediatrician. So what are the tips that you would give to mothers out there who are struggling with breastfeeding?
They need a lot. Many of the mothers need a lot of hand holding, and a lot of time needs to be spent, especially if they are first time mothers, because the kind of negativity which surrounds them, the grandmothers around them in the household, their own mothers around, the moment the child starts to cry, there's so much negative input given to the mother in the form of comments such as you're not getting enough milk, or your baby doesn't know how to suckle, you're just you have to start bottle feeding, or you have to give the sugar water, or you have to give a formula feed, you're doing the wrong things, you're not getting enough milk. So these are such constant negative comments given to the mother that she loses the confidence to breastfeed. Already postpartum phase is a very vulnerable phase, hormones are acting, or mothers are most very disturbed in that phase, and a lot of positive reinforcement and positive comments are so important. So we pediatricians not only are counseling the mother or helping the mother with breastfeeding, we are actually silencing the negative comments coming all around the mother and trying to shield the mother from all negativity, so that she can then focus on breastfeeding, and she can do a good job if there is positive support around her. For breastfeeding, from the baby's point of view, if the baby is a term baby, proper positioning, attachment, latching, these are very important. And they need guidance with this. They need the guidance of what a correct latch is, how to position the baby, what are the different types of holding the baby, what is right, what is not wrong. Sometimes they would want to lie down on a side and feed, if that is okay. So it goes by whether the mother has had a caesarean section or if she has had a normal delivery. Because if there is pain, we would have to adapt to how the mother is able to position and feed. There is nothing right or wrong here. We have to adapt to what is the actual situation in that particular family. We learn a lot about family dynamics by interacting with the parents, and then we phrase our terms and our language based on how the input is around the mother, all the time trying to protect the interests of that baby and the mother. And it takes multiple sittings before we are trying to push our agenda through of shielding the mother and the baby. But till that happens, we don't let go of the goal of getting the baby to breastfeed. And that whole this bonding between the mother and baby sometimes takes 2 or 3 weeks even, and still that goal is met. We try and keep persuading the whole family to support the mother, and it's a journey. It's a journey, and this journey is the route it takes is very different for each family.
Yeah. Give me an example of where you think that you had to give lots of breastfeeding inputs so that people understand that exclusive breastfeeding is possible.
Right. No, we have had many issues. In fact, even now we have many issues. And I think the most important or the most difficult one to handle has been parents, grandparents being around who give very negative vibes. They are all ready to, push in the bottle, push in the formula. And that is where, the lot of effort goes actually in convincing them that the mother has enough milk. In fact, every mother born has enough milk for 2 babies at a time. She just needs the right guidance. And the only stimulus for breast milk production is not the roof on her head, not the diet she eats. In fact, babies born to mothers who are laborers on the roadside, digging the earth on the roadside, and they would have tied their babies to their breast, and they will still continue to work. Those babies do pretty well till they wean the child. That is because those mothers don't have a good roof on their head. They don't have the best nutrition. Babies are parasites. They derive their nutrition at the cost of the mother's health. So that input of telling each of these mothers that there is nothing like an insufficient breast milk. The only stimulus for milk generation is the baby suckling at the mother's breast. That's all what is needed. The more the baby suckles, the more milk a mother generates. Nothing else matters. So the whole thing, I think, of formula being promoted to a large extent comes from the pharma industry as well. But I think in general, working mothers, mothers who have to join back work very early after delivering, some are joining even by 2 months. So there has been a constraint, less awareness about expressed breast milk. And I think once we promote breast pumping and storing of expressed breast milk, we can even manage those situations to a large extent and promote breastfeeding as much as possible.
How do you know breast milk is enough? I know you said that every mother has milk enough for 2 children, but how do you really know? Because children cry even after feeding. So, what do you have to do?
Correct. So the objective parameter would be the weight gain. So that is a simple way of knowing. The other way of knowing is the urine output. So if there's any baby who is passing urine more than 6 times per 24 hours, we know their breast milk is sufficient. And third parameter, which may not be a very accurate one, is the sleep. Some children do sleep well after a good feed, and some don't sleep as well. But that is not a main criteria as such, but it's more the urine output and the weight gain. These are two important criteria to say that the breast milk is enough for any baby.
Okay. So, breastfeeding for the mother, the child is born, and when do you now begin vaccinations?
Yes. So vaccinations are given at the day of birth, on the day of birth itself. We have BCG, oral polio, and hepatitis B given at birth. But the regular vaccinations start from 1.5 months of age in India. We give vaccinations at 1.5 months, 2.5, 3.5 months. Then we have other vaccinations which come at 6th, 7th month, 9th month, and 1 year of age. So there are vaccinations which come at regular intervals in the first year. And the first vaccination starts at 6 weeks or at 1.5 months.
Okay. Do you believe in vaccinations? There is so much distrust out there. So what do you feel vaccinations do?
So vaccinations have been the single most important discovery of mankind. From our life expectancy being 25 and 30 in our own grandparents and great grandparents, we have now reached a life expectancy of 70, 80, 90. And that is, I think, to a large extent, the credit goes to vaccinations. A lot of infection control has happened because of vaccinations. We don't realize the importance of vaccinations because we hardly see the vaccination preventable diseases. For example, diphtheria is such an uncommon disease now. My seniors, my professors had seen a lot of diphtheria, but we hardly see diphtheria. We hardly see pertussis. We do see tetanus occasionally, but the incidence certainly has come down. Hepatitis B, hepatitis A, typhoid. A lot of the diseases are at a much lower prevalence now only because of vaccination. I think vaccination complacency has set in because we don't see those diseases as often. If people saw diphtheria or tetanus or pertussis on a regular basis in the community, I think then you will realize the importance of how these vaccinations have actually helped in preventing the incidence. Because the vaccination level, say, in a community reaches 60 or 70%, it does protect the spread of disease in the community through herd immunity. And that is where, people start questioning whether we really need vaccinations. We hardly see any of these diseases. Why do we need vaccination? And of course, there is a big anti-vax campaign happening online, social media. And the way they put things across, it is so convincing that very educated people are now totally taken in by this. They feel it is pharma driven, and there was a lot of disservice done to humanity, I would say, by linking MMR to autism, and that led to a lot of children, a lot of parents avoiding MMR altogether. And but that's another story in itself. But vaccination definitely has changed the way change the way children are now affected with diseases. Many vaccine preventable diseases have really benefited children's health, reduced infant mortality, and in general, community health has improved only because of vaccination.
Okay, so I totally understand vaccinations are important, especially for those horrible, deadly diseases. But Are we at the point where it's too much? Are we administering too many immunizations? Is that at all a concern, both, I would say, for pediatrics and adults?
Right. So there's nothing as too much. See, disease patterns have changed. In the 80s, 90s, we hardly heard of dengue. We had a lot of other diseases like mumps used to be very prevalent then, measles used to be very prevalent. The whole spectrum of diseases have changed with time. Now, and we never saw COVID then. We never saw so many diseases now are new, and the incidence of many of these diseases have increased over a period of time. The whole spectrum now is of, see, dengue has increased quite a bit, which was not even there in the 80s or 90s. So vaccinations have to adapt to what is the relevant problem in a community at that point of time. We had Maruti, 800 in the 80s and 90s. We have now moved to Benz and we have the best engines. Do we still sit with Maruti 800 engine just because it came in the 80s? No. We have to move ahead with what is available now. The technology now for vaccinations have changed a lot. We have a lot of combination vaccines. We are able to offer protection against a lot more diseases. So we are actually wanting more vaccinations for diseases like malaria, which is a big public health problem. It has just come into the market, and if it is, after all the trials, and if the efficacy is good, we may have another newer vaccines coming into the market in the near future. We should welcome them with open arms, because every disease out there, if it has a vaccination, we are actually saving a whole lot of children who are going to fall prey to those diseases, and a whole lot of adults who are also going to be affected by the same diseases.
Okay. All right. Well said. Okay. So we have the same child, mother breastfed the child. The vaccinations have been administered or are being administered now for the first few years. The child is now 1 year old. And the decision at the age of 1 or 2 to send the child to play school versus keeping him or her at home all day comes up all the time. So what is your input or your take on this?
I would say it goes by the social circumstances. There is nothing right or wrong here. Women now have to go and work. I think it is important because having a job is as important, because for the time and effort they have put in educating themselves, it is important that they should be able to balance the household as much as they would want to work, and also improve or further their careers. So if they have a proper support system around them, like if they have an extended family at home who can take care of the child, or the setup where they have an effective care, which is assured to these children. Schooling then is not really important. Whether it's a daycare or a school, finally we are just looking at a safe place for a child who is taken care of, who enjoys, has a good time till the parent returns from their work. Even if one parent is, say, at home and they still want to send the child to a daycare or to a school for just a social interaction for a couple of hours every day, that also is not a wrong thing to do. So I think whether they want to send, I don't see this as, that the child should start learning very early. By going to a school, they are going to pick up a lot of skills. I always call these schools or these daycares as a factory of germs. Whether this child enjoys or learns is secondary. They actually go there and they are exposed to a whole lot of bugs. They are going to pick up a lot of germs, and we don't have a bypass route for it. Babies will be exposed to these germs. If not early at 1 year, they will be exposed when they join school. And in fact, we have realized that amount of exposure is needed to keep their immune system up and functioning well. So from that point of view, I think school or daycare is actually just a necessity for working mothers. School, I think it's more for the social interaction and to give the mothers or the family members a break from taking care. And some children are really social. They seem to enjoy, going to a new setting and exploring toys or playing with other children. If that is the case, it's fine to, let the child go to a school. But using a daycare becomes a necessity for many families who have no support system. We should just support those families as well. It's their circumstances which has made them put the baby in a daycare early, and there is nothing wrong in it.
So parents hear this line all the time. Before the age of 5, before the child is 5 years old, do not send to daycare. Otherwise, the child will fall sick more often, and that will continue till the age of 15. Is this true?
So children do fall sick more often, no doubt, in a daycare. There is no doubt about it, because when a lot of children who are in that age group are together, and many of them are respiratory diseases, airborne infections, it's very easy to pick up an infection. But it may not be a practical solution, or to give a guideline. Do not put your a child in a daycare till 5 years of age. There is no study which says that after 5 years, if you put your child in a daycare, your child is going to do well or will not pick up an infection. The risk is as much as going to a daycare or going to a school. It's all the same. If you don't put in a daycare, but you're ready to send your child to school by 2.5, the child still is exposed to a lot of infections. But not exposing your child at all till age 5 to any daycare or school setting, then, even after the age of 5, if a child is going to join school, this child is going to be exposed to a lot of infections. So later on, but maybe they are in a better position because of their age to handle those infections better. But again, how practical is this advice going to be as to not to send your child to daycare up to the age of 5 years? I think most children, I have not come across a single child who hasn't gone to school till the age. I've come across just one or two families who have homeschooled throughout. But by and large, I think most kids are in school by 2 years of age. 2.5, they're all going to some school.
So this is not a correct notion that sending your child at the age of 2.5 to a play school is actually weakening their immunity.
No. In fact, exposure to infections is actually priming their immunity, and about 6 to 7 infections a year are normal for every child. And this is what primes the immunity, and it gives them the immunity against common germs, so that when these children are, they enter first grade, they're actually doing pretty well in terms, they're not falling as sick as they did when they were 2 or 3 years of age.
Okay. So now let's say the same child is going to a play school or even to a regular school, is somewhere between the age of 2 and 7, continuing this, falling sick regularly, and somewhere down the line, the child has had either allergies or bronchitis or some kind of inhalers have been introduced. So I feel like this is one big thing which is happening everywhere around us, especially in the cities. Also, I think tier 2 and tier 3 cities, and we are hearing it time and again. Do you think it's overuse of inhalers, or it is something that is a necessity now and that we have to use it?
Right. So again, inhaler use has just been a technology change. So previously, syrups and tablets were the traditional way of giving any medication. This would be, we would swallow it, it goes into the stomach, it gets digested, it gets absorbed, it goes all over your body, including the lung and the bronchial tissue or the lung tree where it works. Now, by using the inhalers, we are bypassing this. We are giving medications at a very low dose, which goes directly into the lung tree, and the action happens at a local level. And so the dosage of using these medications have dropped from milligrams to micrograms. So we use, say, 50, 100 micrograms to get the same effect as what we would get with 1 or 2 milligrams of the syrup. So inhaler is just a different way of giving medication, which was traditionally given in the oral route, has now shifted to the inhalatory route. Now, so the whole worry of using inhalers has been whether it will cause addiction, or whether it will, whether this is going to make my child asthmatic, or whether they are going to need this lifelong, the side effects of using these inhalers. Inhalers have now been with us for almost 30 years and even more. And we have a number of studies of the effectiveness of inhalers. And when compared to syrups or tablets, they are far superior in drug delivery, in absorption, and also the way we have gotten a control of all the child's symptoms has happened only because of the use of inhalers. So when used correctly, when the prescription is followed correctly, and when we have the right kind of information, inhalers has been a game changer for many kinds of bronchitis. Children used to be regularly sent to an emergency. They had to be admitted in hospitals previously. And now the admission rate has come down considerably because we are able to guide parents to use the inhalers correctly, and a lot of symptoms. And, we have been able to manage them very effectively on an outpatient basis only because of inhalers.
Okay, so I know that not all inhalers are steroids, but how do you deal with parents and their fear of these inhaled steroids? They always feel like it's either suppressing the immune system of the child or worse, stunting the child's growth. How do you deal with
Right.
it?
So steroids, I think the word steroid itself seems to, freak out many parents, and rightly so. But one has to remember that if steroids are given as milligram tablets and given for prolonged periods of time, only then they suppress the immune system and have other side effects. In inhalers, we use steroids which are in microgram dosage, which acts locally on the lung tree. Inhalers, inhaled steroids, when given in that particular way, are not harmful. In fact, they are so beneficial, and they have such a good effect because they also help in other inhalers to act, which are non-steroidal inhalers, act better when we combine them with the steroid inhalers. And it's like, using eye drops, or we use a local, skin ointment. We never worry about them affecting your whole body because they are not going to get circulated into your whole body. Similarly, when we use steroid inhalers, even if the inhaler has a steroid, they act so locally at a very, very low dose. They're also helping non-steroidal inhalers act better with minimal side effects. And when we have a medicine which acts at a low dose with no side effects, and when there is very quick improvement, this change in technology, which is for the better, has to be adopted by all the parents. We sit and counsel the parents, telling them the negatives of not using the inhalers. In fact, the damage caused to the lungs by not using the inhalers is far more. We end up, in the early 30s and 40s with adults, young adults having COPDs, with having chronic bronchitis because they have not used inhalers at the right time. So, but that lung damage is not visible. It's more the side effect of the medicine which is visible to a parent. But so we have to sit and counsel them, saying that leaving your disease process untreated or treated in a wrong way has more deleterious effects on your internal organs than your worry about, the side effects of inhalers, or especially of steroid inhalers. There are a minimal amount. There are some side effects, no doubt, but when the benefit risk ratio is more towards benefit, we would want to accept it, just as we have done with COVID vaccination or with any other vaccination. The benefit risk ratio is always towards benefit. We accept it. And we do monitor children who are on long-term inhalers. We do monitor them for side effects. We do have regular checkups which have to be done. And if all those are followed, and if the follow-ups are done at regular intervals, inhalers, whether they are steroid or non-steroidal, are very safe to be used in children, and it has been a game changer to treat children with asthma under 5 years and many children with bronchitis.
Do you see children coming off these inhalers?
Definitely. We have many children who come off inhalers. For some, we are not able to remove them, but for most, I would say we have an entity called transient wheezers. They need the inhalers, for a duration of till they have that wheezing. And once the wheezing is settled, we stop the inhalers. Not that, we start the inhalers and they have to be used lifelong. It goes by each child's condition. Most children, we are able to stop inhalers after, they have come out of their allergies, or at least when the allergies have reduced, we are able to taper off the inhalers and stop them. A small, minuscule percentage of children who sometimes have a family history of asthma running, they may need inhalers which may be needed for even a few years. But even in those children, we are able to monitor them very carefully and see that they come off inhalers whenever possible. We try and give them drug holidays when their symptoms are at a very low level. So they just need to visit the doctor at frequent intervals and get the guidance of the doctor, because we also, our whole aim is to give them good symptom relief, give them good control of their symptoms, and the moment they have a good control, we would try to stop them off as early as possible.
What is your take on alternative medicine? I know tons of people must come and ask you, but what is your
Right.
take on it?
So I'm the wrong person for this, because I'm sure each system of medicine has its own benefit. I'm the wrong person to even comment on this, because I'm not trained in any other specialty. But I would, however, do raise a query or a question. I mean, I would want to really sensitize people about going with the right medication, even if it's an alternative medicine, because we do see a lot of children who come to us with the liver enzymes being out of range, with renal issues, and invariably when we actually go back and ask them, they are on alternative medicines, and so there is always a worry whether any of these alternative medicines do cause harms, because some of them do have heavy metals in them. So we have to be very careful in knowing what is the drug we are giving to our child, what is the composition, how do they work, have they been randomized control trials of those medication. I think where alternative medicine really falters is there. We don't know the structure. They are not transparent about the kind of studies which have gone on in these with these medication. What are the side effects of them? As a blanket thing, we cannot assume that they are all safe. I think that would be a wrong assumption. If alternative medicines have more randomized controlled trials, and if their structure is known well, and if we have more studies on them, I think it will be a lot more acceptable to the allopaths, and we would not worry ourselves about whether this liver toxicity is because of the alternative medicine used by the parent, or if this kidney failure was because of an alternative medicine given to the child. I think for all allopaths, our whole suspicion is because they are not transparent about what is the content, and the lack of proper studies, which we would see with all allopathic medicines.
Okay. Well said, I think, yeah. So now the same child, the child was born, came to your clinic, breastfed, went to school, got vaccinations, and now he is not in a play school. He or she is going to regular school. And we see so many things with modern day parenting and regular schools, long hours, long list of subjects. So what do you feel, where do you feel is modern parenting headed, or what should it ideally be like?
Yes, this topic is something very close to my heart, because I see a lot of hyper parenting happening nowadays. I have coined it hyper parenting. I think over parenting is a known terminology, because parents are now shuttling the child from one class to another, a full day at school. And after that, this child has, such a structured day from morning to night. This child has no time for free play, free exploration. I think this, concept of just climbing a tree or doing things on a spur on your own doesn't exist anymore. Everything is so structured, controlled by the parent, whether the child likes it or not. So school years, I feel the parent, it is more, I think the control can be less on the child, and we can just follow the child's leads. Things which really need monitoring are screen time for sure, and the diet. So these two, I think, is in the parent's domain. Because if a parent shows firm parenting with both of these, where the parent is very strict about no junk diet in the house, no high sugar or no butter, ghee, or fried food in the house, no sweetened drinks. If the parent is able to bring in that control, that goes a long way in improving the child's health. The other thing for school age children would be the screen time. Screen time undoubtedly has really increased these days, and I think where the parent control should be is on these two, and not on the other things such as what class the child should attend or how many classes a child should attend every day. That freedom, I think we should give it to the child to decide, based on their interests. So I think we should move away from hyperparenting to making it more inclusive, where the child has actually a say in every activity the child goes to. Schools, no doubt, are really long hours now, and many schools have a lot of academic pressure, lot of writing to do, lot of projects to do. In fact, parents are more stressed doing their homework of their children till late in the night after they have returned from their workplace. Again, more. I think the whole system of education should change. I think that's a dream. I do hope things do change where it becomes more exploratory, and more hands-on from it being more theoretical what it is now. But again, that's a different topic of discussion. But having shorter, I think the attention span of most children has really reduced, more because I think the distractions are way too many these days. So if we can just take the cues of the child, and if a child is tired, doesn't want a particular activity, that kind of flexibility should be there. And the flexibility for free play, the flexibility to pick any toy or choose a friend to play with. Parents' role should be limited to controlling screen time and to look at the diet and provide a balanced diet to the child and be good role models themselves. We can't be eating mixture or chips ourselves or juice, highly sweetened juices, and then expect our children to have only fruits and vegetables. That is not going to happen. So I think the first step for any parent is to be a good role model themselves, and only then the children are going to imbibe the same environment which is being created at home.
Okay. So you definitely mentioned, low screen time or no screen time, maybe even better. I think let them play around on their own. And then you emphasize diet. Now, if a child is mainly eating at home, does it have to be zero sugar or a little low sugar and homemade dessert is okay? Because I feel like this is a big debate going on nowadays.
Right. See, low sugar should be okay. I think to an extent possible, it need not be a zero sugar diet beyond a year of age. Infancy, we recommend a zero sugar diet, added sugar diet. After that, so what happens is there is a lot of added sugar in many of the packaged foods, which we don't even recognize. In addition, we make homemade stuff, which is fine. We are controlling the amount of sugar, an occasional dessert here and there. That should be okay. The binge eating with, a lot of highly sweetened foods, foods where there is added sugar. And nowadays, packaged foods have sugar. They may say zero sugar, but sugar, is added in 70 other ways. You have this corn starch, corn syrup, fructose syrup is added. So it has different names, which may not, read as sucrose. So we have to read those labels carefully, because zero sugar does mean that there is no zero cane sugar. It doesn't mean it is not a sweet food. It is definitely sweet. So I would say just be very cautious about the different names of glucose, or it's like there is some maltose is written on some, or sugar corn syrup is written on a few, or high fructose or fructose syrup is written on a few other products. So all of this means sugar. So once we are wary of these, then we are able to control the amount of sugar in the diet. So that occasional dessert which is made at home, I think that should be okay. We promote more of fruits, we promote more of vegetables, because the sweetness, the sugar which is there in these fruits or in vegetables is a better sugar, as it is present with fiber. So the absorption of this sugar happens in a more gradual way, and these foods are typically have a low glycemic index, which is conducive to the body's metabolism. Versus foods like ice cream, or some desserts which causes an instant high, and that is what is harmful to the body.
Okay. So we covered a lot of ground, right, about a child who's gone to school, vaccinations, diet, screen time, things. What about those parents who have a child who has special needs, or one of those rare diseases which occurs in less than 5% of the population? What is it like to deal with that patient and the family?
Yes, so it's a heartbreaking situation to deal with a family with special needs. It may be a rare disease, but it is 100% for that family, 100% for that parent going through. And though bulk of the research money goes towards funding for common diseases in the community, there is definitely a place where money has to be put on rare diseases as well, because the funding for that research is important to find solutions even to those rare diseases. Very often they are called orphan diseases because nobody even looks at their needs, or hardly any drug development happens. No research is happening in many of the diseases, which is really sad because those parents are also struggling. And I think it is important, research and funding money should go towards rare diseases as well, so that whatever drug delivery, I mean, whatever drugs can be offered to those children, I think an earnest effort has to be made for that as well.
Okay. All right. Let's hope that everybody is healthy out there. I really hope that that happens for everybody. But there is one question that I want to ask you. Why is there so much distrust about medical profession and professionals? People distrust doctors so much these days. Why do you think that has happened?
Right. I think to a large extent, it's lack of proper communication. I think the basic defect of mistrust is because we don't communicate as effectively. Sometimes what the patient says, the doctor has not understood, and sometimes what the doctor has communicated, the patient has not understood. So it does take a lot of time to sit and to actually clarify. Sometimes we have to actually ask the patient as to what they have understood, and then we see all the, the loopholes and where we have actually faltered in communication. But this does take a lot of time, and in a busy clinic or in a busy hospital, when a doctor is multitasking with 100 things are happening all at the same time, communication definitely suffers, because for effective communication, for a doctor to spend enough time of even half an hour, 45 minutes, there's just so much strain on the doctor to sit and spend that time. It's just impossible sometimes. And I think primary mistrust starts from there. And to some extent, I would also want to defend my profession, because hospital costs and even running costs of any clinic has increased substantially, more so after the COVID pandemic. So just basic running costs are now very high. How does a hospital or a clinic recover? They have to, I mean, by an ethical route, not that they are going to overcharge, not that unnecessary investigation needs to be done. It need not be done. It's just that regular costs itself have gone up. And as long as we are open about what the costs are for any particular, say, a consultation, or for a vaccination, or for any procedure, or for the blood lab test, if everything can be openly communicated beforehand to a parent, and say these are the costs which is there, and at most places I would say it is ethical. There may be a few rotten apples in any profession. I think in every field we will find those, but that should not lead to overall impression about a whole profession, or blanketing all the doctors as bad, or all hospitals are money making. That would be a very wrong assumption. There are many people out there who do real ethical compassionate care, and I think if we are better with communication, if we understand the patient better, and if we are able to sit with them, spend the time, I think a lot of the mistrust can be pushed aside.
Okay. So I agree with you completely. There are many good doctors out there, but do you think hospitals have added to this problem when they repeat laboratory tests unnecessarily without even realizing patient maybe just got it done 24 hours ago, or having very specific 10 to 15 minute slots, for physician patient time? Do you think this has added to the problem?
It may have added, but the patient's condition may have also warranted. Like, for example, if a child or has dengue, we would want to do, in fact, every 6 hours, we would want to do a blood test there. Or sometimes even, or if a child is admitted in an ICU, the condition is like that. Those parameters actually guide us to add or remove a medication or help them monitor better. So some conditions, not all, some conditions do warrant a test. Some condition needs repeated blood tests to be done. So again, you cannot generalize and say this hospital is wrong or they are doing tests frequently. It just goes by the condition, what we are dealing with, rather than blaming the hospital for doing it, isn't it?
Okay. All right. Understood. So, what is the one thing that I should have asked you, Dr. Gayathri, but I haven't? What is it that you would like to say to the community out there?
Yes. So I just want to tell that we don't own our children. Okay. And I really love this quote by Gibran, which says that children come through you, but not from you. That means we are just a doorway here, and they have just walked in through this doorway. The path is theirs. They must walk their path. They have to write this their own story with their own hand. We are just holding a net behind, seeing that they don't fall, and we are there to hold that fall. Do not protect your children from failures. Every failure teaches your child an important lesson. It's okay for the child to fall, get up, be around, encourage your child to get up. Don't rush to pick them up. I think where modern parenting is lacking is we have previously extended families were there, where grandparents were there to advise, and there was a support system in place. Now those support systems have disappeared. We have nuclear families. Both parents are working, and there is a lot of pressure on time. Childcare is a big problem. If a maid doesn't turn up, or if the daycare has closed for some reason, immediately there is panic. And I think the solution has been to put these children into more and more classes, or keep them totally occupied from morning to night, so that the parents are free to attend to their own work. And whatever and some of the parents, what they have not achieved in life, they want to achieve it through their own children. Right. So the freedom we have to give to our children, because each of them have, they are distinct. They have their own thoughts, their own ideas. So as a parent, our role would be to guide, to nourish them, to encourage them to follow their own path. We don't own them at all. They have just come through us. Let them make their own path. We just support their journey. I feel that very strongly, and I see more and more parents who are really hyper parenting. I think we should just withdraw and let the child take the lead. I think they will do a good job on their own. Of course, we are there to see that they don't go off the track. But beyond that, I think our role ends. I think we take parenting too seriously. We have to, learn to let go a little more and enjoy the parenting process, rather than try and control our little children out there.
Okay. Anything else you want to add?
What has also been very heartening is the involvement of fathers. Even early in my practice, I didn't see many fathers being involved, but now the amount of involvement by fathers, I find there's a huge generational change. Fathers are hands-on, doing everything what a mother does. And I actually joked with them. I said, if you had a pair of breasts, you would have even done the breastfeeding. And that I think is so heartening to see the fathers being so involved with childcare. This has been a complete change from our own grandparents, from our own parents even. I think what I see with this generation is the involvement of fathers. That has been a very heartening change, especially in the Indian society. I think for Westerners, it's not a big thing. It's always been that parents, it involved both mothers and fathers. But in India, somehow, working mothers had this added responsibility of childcare. Plus, of course, the traditional roles of running the kitchen and taking care of guests and in-laws and all that. Those were traditional role for women. Plus, with time, most educated women are now working, which is how it should be. Plus, added burden of childcare would stress them out, and I've seen a lot of mothers on a verge of burnout. And it's so heartening to see the fathers step in and help the mothers. And when both the wheels of the car move in the same direction, it has been a smooth ride, or at least they've been able to support each other. And I find children coming out from such families are far more well settled, and they are able to handle the stresses of life, and they seem to fare much better. So that has been something very heartening to see over a period of time. Yes.
Awesome. No, I hope that my children see this podcast and my parents and my in-laws see it, because I think you've said some wonderful things here.
Thank you.
Yeah. So thank you so much for joining. We really appreciate it, Dr. Gayathri.
Thank you. Thank you so much, Divya. It has been a pleasure talking to you.
You too.